One of the things that's important in all industries, and dental in particular, and medical in particular, is we have been at our job so long and we use language specifically for our industry that is very common to us, but it is not common to our patients or customers. And this is something that I want you to think about. And what's interesting is research shows that if you use language or terminology to people who are not educated, they are intimidated to ask what that means. If you use that language, jargon, lingo, to people who are highly educated, they're certainly not going to ask you what you mean by that. They are a lawyer and they are not going to say they don't understand something. So something to think about. Now, these are words that I talk to a number of dentists about, and they tell me they use these all the time. And I need to tell you, I don't even know what a composite is. And they laugh. They go, "Shut up, yes you do." And I said, "No, actually I don't." And with specialists, on the bottom left, there are so many different specialists, and we don't know what they are unless you have a lot of dental issues. I don't know what a periodontist is. Or I just heard one recently who specializes in gums. And think about this, because this is language you use to each other all the time. It is things that oftentimes, most of the time, your general patients don't understand. So think about that and explain. And what I would do as well before I started explaining any procedure is say, please ask me if you do not understand something that I'm telling you. Another thing that's important is pet peeves. We all have things that just annoy us. We have things that when we hear it, we get frustrated. When we see it, we get annoyed, and we need to be careful about this because sometimes our pet peeves can lead to very, very poor customer service. So one of the things I wanted to mention to you within the pet peeves is something that's called a trigger word. And a trigger word is a word that you hear, and it could be more general that it annoys most people, but sometimes it's just specific to you, and it's a word that you hear that immediately puts you on the defensive. And what happens when you get put on the defensive, you stop listening. So let's say my dentist is telling me something that I need, and if he includes in there, you know, you never floss, which of course my dentist would never say. If he says that, you never is considered a trigger word. So all of a sudden, I stop listening, and I start thinking about back to the times. Yes, I do floss. I remember I flossed 2 weeks ago. One of the biggest keywords for everyone is policy. And this is a tough one because we very often revert to blaming policy for why we do things. I was working with a medical firm recently, and we came up with other words they can use instead of policy. And one of the gals said, I think what I'm going to do is explain to people that we've made a decision based on the health and comfort of our patients to do it this way. Think of that because, again, policy generally equals people on the defensive. Here's a few other trigger words that clients, classes, and I have thought of. You, constantly, never, and always. And even when I say that, my stomach kind of does a little flip. You as a trigger word, constantly, never, and always, even makes it worse. Don't make any mistake about it. Very condescending. To be perfectly honest, and what does this imply? This implies that normally I'm not, but you know what? This time I'm going to tell you the truth. With all due respect, also seen as very condescending. Whatever. I have to tell you, there was a national survey with this, and it came up as the #1 most annoying word, which I loved. I actually have in my college syllabus, do not say whatever, especially combining it with the whole hand movement and the head nod. You know what I'm talking about. That is a trigger word. Now again, you might say, I use that all the time, it doesn't bother me. I'm just talking about words that people find offensive. Might not be for you, but it might be for someone else. Correct me if I'm wrong. Generally, that person is not remotely asking you to correct them. Again, it comes off as condescending. Don't get mad, don't get upset, but. Now the word but generally negates everything you said before it. So you want to have a period after anything instead of putting a but in between two different sentences. Don't get mad and upset generally preps the person that they are going to get mad or upset. I don't want to hurt your feelings. As soon as I hear that, I know my feelings are going to be hurt. And if you don't want to hurt them, don't say it. Don't take this personally. Of course we're going to take it personally. And this is generally followed by something that is extremely personal. Calm down, big trigger word. And we tend to use this quite a bit. And when we say calm down, we're actually putting the other person on the defensive and making the situation worse.